I'm Dr. Mark-Ohriner, solo practitioner in Las Vegas, Nevada. I've gone to using the smart plug because patients do not tend to feel it or know it's in there. Most patients have less sensation with the smart plug than they did even with the collagens. Treatment of choice is pretty standard. We start with artificial tears, and it works 20–30% of the time. Most of my patients don't particularly follow the regime of putting in eye drops every 1–2 hours. Some have to do it every 30 minutes. So punctal occlusion is a very appealing alternative to them. The smart plug is a very simple, quick procedure. Most people barely are even aware that you're doing anything outside the fact that you're touching their eyelid. Most people, when I use the smart plugs, they tend not to even realize that the plug is there to a lesser degree than the collagen plugs, because it's a smaller diameter plug going in. Also, when they palpate their eyelids, they don't feel it. They can't tell that the plug is there, and that is what most of my patients truly appreciate, is not knowing that it's there.
My name is Dr. Margitza. I've been practicing here in Las Vegas for about 17 years. I've been at this location now for the last 7 years, and have developed quite a busy practice based on the dryness that we encounter here in Las Vegas. Initially, the plugs used to go in kind of like a nail, so you'd have the head of the nail which would rest on the eyelid. So even though it would help your dryness, every time a patient would look in that direction, you felt the plug. Not only that, but more times than not, the older plugs, if you rub the right way, were popping out. Since the smart plugs came out, I've been using them now exclusively for the last 3.5 years. The smart plug goes in, responds to the body temperature, goes under the surface. So one, patients don't feel them. Secondly, they could rub, and the plugs basically are less likely to come out than the older plugs. So as far as patient comfort and to keep the plugs, as far as them not being lost, those are the biggest advantages. Number one advantage, of course, is having your own natural tears as opposed to an artificial tear coating the eye. Our own tears have natural antibacterial effects, enzymes that fight off the irritants in the air. Insertion-wise, very easy to insert. One size kind of fits all, and they conform to the patient's punctal area, so it's a better plug as well for that reason. In a couple of cases, we did remove them. We had a patient who relocated, and was here in Vegas. We needed 4 at the time. Moved to somewhere in Texas, I believe, and she said she was getting a little bit of a epiphora, some dripping. So I removed the uppers. I've probably done a dozen removals and stuff, and very straightforward. We've made a lot of patients' lives change with taking care of the dryness.
I'm Dr. Brian Wachler, and I practice in Los Angeles. When we have dry eye patients, using the smart plug has become a very excellent adjunct to our dry eye management for patients. Whether it's primary dry eye patients or after refractive surgery, the smart plug has really proven to be an important tool that we use for patients, and the satisfaction is high. And in particular, patients can't feel the plug. So I explain it to be a little bit like a dental filling, in that it's there, but they don't even know it's there. And it's been wonderful. So I've been very happy with it.